mom, Dr. Karan. Thank you for doing this interview. So, first, I would just like to start off by saying that are you okay with this being posted on the open web, UT Library Reserves, or in course Canvas?
Sure.
Okay. And this is only to be viewed by the class students of my biology class.
Great. I'll be happy if it could help in any ways to graduate students
And undergraduate.
and undergraduate students.
Okay, thank you. So I'll just start off with the most basic question. What is your profession and what do you do in your profession?
A very good question. I'm a physician. I'm a medical physician and I save lives. It will not be exaggeration if I say I save lives. I take care of the diseases and try to cure them. Of course, it is not every disease we can cure, but I try to help the patients who are sick.
Okay, that sounds very cool. You are the reason why I chose biology as my major. Okay, so let's talk about your passions and interests. How were you able to find your passion to becoming a doctor, or when did you know you wanted to become a physician? Tell me that story.
Yeah, my grandfather was a physician and I'm from a small village and he used to visit the village. At that time I was very small and used to see lot of respect he used to get from the patients. Patients used to wait for him and he used to give them the medicines and that used to decrease their pain, agony, sickness and all that. That made me think that he does such a good job in taking care of pain for the patients away or their sickness away. So that's how I got attracted to say, okay, I want to become a doctor.
How old were you at that time?
I think by the time I started getting impressed about him, I think I was maybe 12 years, 13 years old.
Wow, that's early. Okay. So let's talk about your educational experience. What advice would you give to current students that are interested in pre-health, pre-pharmacy, pre-dental? They're still starting, including me, that we're still starting our undergraduate journey. So what advice would you give to us?
Medicine needs a lot of patience. It's a pretty long journey. Persistence, patience is very important. If you get tired or lose the patience, you become impatient, then maybe this is not your field. You really you have to sacrifice a lot of things in life and if you are passionate to do those to achieve your goals, you will not feel that it is a sacrifice. You will rather enjoy that what you are doing. But I think yes, it is very important that patience is very very much needed for this profession.
Okay. So how is your undergraduate education helpful in what you do now?
In India, I really didn't have an undergraduate school. Rather, we had a 10+2 syllabus, like up from kindergarten to 10th grade. It was a school, and 11th and 12th was considered as a junior college. And then after that 12th grade, we had to take the exam, and once you get some scores in those exams, you get selected for the medical school. That's your undergrad school.
Okay. So, what was some of the classes that you enjoyed the most?
I enjoyed the biology, especially zoology most, and zoology was the science for the animals. So we had dissection of the frog. We had dissection of the earthworm. We did dissect different systems for the earthworm. We did dissect different systems for the frog also. So those things were very fascinating to me.
Cool. So, if there was one thing you could redo or one thing you regret during your sort of 10 plus 2 experience, what would it be?
I think I ignored my health and other interest a lot, as well as the family during that period of time. I was very focused on what I wanted to become. So some of the other interests I could have enjoyed and that could have helped me perform better were missed.
I see. Okay. So, you went to medical school in India. So, what tips would you give incoming medical school students on applications?
Again, application has a personal statement or personal story part of it, and try to be I will say try to be truthful, but at the same time elaborate. Try to explain what were your thought process, why did you choose this, how did it channelized you to go towards the medicine, and just not the that I want to become a doctor, so I became a doctor. No, there should be something which somewhere in part of your life you watched or you got attracted towards, you became inquisitive, and then you wanted to become a physician or a doctor.
Okay. What do you believe are the most important skills that a doctor can possess?
Doctor has to be very, very, very patient, has to be a good listener, and should have a special eyes and ears to diagnose the things. And there is a saying that eyes cannot see what mind doesn't know. So if you didn't read enough, you will not be able to find those things. You will not acquire that skill to look for it. So those are the important skills a physician need to have.
I agree too. What did you enjoy the most about medical school?
Medical school life was free. You were not responsible per se. It's like you're still learning. You are trying to go through different rotations and enjoy different parts of the career and see which part of the career you like, whether it's a medical part, surgical part. In the surgery and medicine also you had different subspecialties like geriatrics, pediatrics, OBGYN. Surgical branches could be ophthalmology, ENT, orthopedics, podiatry, and whatnot. So it's a plastic surgery. So these are all different arts, and see where you fit into, which skills you have, which mindset you have, where is your inclination channelizing.
Okay. Would you wish that something could be different about your medical school experience?
As you know, in any school or college, you have different teachers, and those professors have so it is very important, like your professors instill your interest, so they could be role modelers. So I feel more and more I look back, I think I had some difficulties in choosing where I want to go, because there were a lot of people who were competitive, and role modeling was little difficult for me to choose.
Hmm. So looking back at it now, would you still choose to pursue a medical profession?
Absolutely. I don't think I could do any other profession but the medicine. I don't think I was born for anything else. I really, still today, I don't think I can do anything else.
So you love it that much?
Yes, absolutely.
Okay. So I know you went through residency in the US.
Correct.
So why did you choose your field of specialty, and what is your field of specialty?
My field of specialty is geriatrics, and actually, this branch does not exist in India. We have it still is under cover of internal medicine. Now, a lot of awareness has been coming up, and people are knowing about this specialty, but still we don't have a separate specialty in there. But here we had, and I saw majority of the patient population was elderly, and they are the ones who needed the help most. Also, I feel personally that taking care of elderly is like taking care of the babies. It's the circle around. So like their favorite word is no. They get easily happy, and so and so forth. So I just chose geriatrics.
Okay. What are some of your most memorable experiences going through residency?
During I did residency in Brooklyn, New York, from the Brooklyn Hospital Center, and it was a pretty tough residency. And during this Thanksgiving and Christmas time, we used to have a lot of admissions. So people from the nursing homes, uh, because of the short staff and also because of the sickness, at the same time the families are visiting their elderly parents during that time, and they find so many things were going wrong with their loved ones, so they will bring to the patient. So that was the busiest time for me during the residency, and that kind of uncovered a lot of patient problems the family could discover and bring it to the attention to the physicians.
Okay. So you did your residency in Brooklyn, New York. What was that like? I mean, I'm sure that was an experience itself.
Yes, that was a very great experience. I'm glad that I did residency in Brooklyn. It's a extremely busy residency. We had 36 residents in first year, and then 6 residents were kind of second year. We had only 30 because the 6 residents were gone to the different specialties like ophthalmology, anesthesia, and all that, which needed first year as an internal medicine residency. So I did internal medicine and geriatrics both, so I'm double board certified. So yeah, and it was extremely busy residency, but it taught a lot. It gave me whole lot of hands-on experience, and that made me very confident when I jumped into the practice.
Cool. And then you did your fellowship in, I believe it was Farmington,
Geriatrics.
Connecticut.
Yes.
Yes, in geriatrics. What was that like?
Oh, that was a very awesome experience. We were 4. That also was a big fellowship. We had 4 fellows for geriatric fellowship, and it was a 2-year program. So they groomed us for both academics, leadership, as well as profession. So it was a great fellowship. I could talk about it.
Cool. So currently, where do you work?
I'm very fortunate and blessed to get an opportunity to serve our nation's veterans. So I work with Veterans Healthcare System.
That's nice. Okay, so now I don't know if this is just a general question. I know you love your profession a lot, But what do you believe are some of the negative aspects of the profession, looking back at it now?
Yes, we do have few negatives. What negatives are those? I mean, those negatives you could, I look back and say these were negatives because of the profession. I couldn't spend much time with the family. So I could not, doesn't matter what I do, but if I'm on call, I had to respond. I had to rush to the hospital and take care of the patients. So, you know, that leaving something in the middle of the day and going back to work is something difficult. So, but that was not something which I had to do it every day. So, but yes, it was one. Then another thing I feel like lots of rules and regulations are made by the non-medical people, and insurances also have a lot of role in the while we make the choices for treatment. So I think if that can be done with the help of professionals or specialists in those areas, that will help to give more liberty to treat the patients, and doctors can have a better life then.
Mm-hmm. So, what advice that you wish you had would be useful to you now?
I wish, really, because yes, it is a profession I have a lot of passion about, but I think if somebody would have told me that you will not have much more control on your life, it would be better. Like, like when I did my first job, uh, we were only two doctors, and we used to take Monday to Monday, 7 days, 24 by 7 call, and we alternated with the other doctors. So, there are a lot of underserved areas where need for the doctors is, and then the doctor has to work hard and, lose the family life. So, if I wish I knew about such things, I don't know if I would have chose then. So, I don't know.
But you're still glad you chose.
Yes, absolutely. I'm glad. I don't think I can do anything better, but I just had a thought that would I have chosen this if I would have known this much busyness or tough life it is.
Mm-hmm. And on the contrary, what is your favorite part of your career?
Favorite part of my career is seeing the smile on the patient's face when they feel better.
Mm-hmm. So, serving veterans, what's your experience in that?
Veterans had a very disciplined life. They served the nation, and because of them, we could sleep peacefully at night. They are all the time on the borders, and they are trying to safeguard our country. And so, when I get an opportunity to take care of them, they have a different. I serve veterans are unique population where their diseases are different as well, like post-traumatic stress disorder. Specifically, when they go on they are combat veterans. When they come, they have a lot of mental trauma because of the because of what they see on the battlefield.
Mm-hmm. So this is one question because I know you were a physician back home in India, and then you redid your education when coming to the U.S. So why did you decide to put yourself through that much stress to become a physician again in the U.S.?
Because I told you I would not have been able to do anything else but the physician. So I got married and came to United States, and of course I could not live without practicing physician,
Okay,
being
so
a doctor.
mm-hmm. So you were a pediatrician and then you decided that now I want to see the other side of life and you did geriatrics.
Yes, and they have a lot of similarities. Pediatrics and geriatrics have lots of similarities.
Okay. Well, thank you for doing this interview. I learned a lot, and I'm sure my peers will also. So, thank you for that.
You're welcome. It's a pleasure.